jump right into this explainer. Today, we're uncovering the incredible, non-stop biological waste management plant that is operating inside you right this very second. It's a system of just unparalleled efficiency, and we're going to trace its entire path, starting from the larger macroanatomy all the way down to the tiny microscopic structures that are literally working to keep you alive and healthy. It's a pretty wild question when you really stop to think about it, right? Day in and day out, your blood is constantly being scrubbed clean. It's removing waste, it's balancing chemicals, and it's doing all of this without you having to lift a finger or even think about it. But how does that actually happen? What are the physical and chemical mechanisms that are literally sorting the good stuff from the bad stuff at a cellular level? So here is our roadmap for the journey. 1. Meet your kidneys. 2. Step 1. Glomerular filtration. 3. Step 2. Tubular reabsorption. 4. Step 3. Tubular secretion. And finally, 5. The final output. Okay, let's kick things off with section 1, meet your kidneys, looking at their location and macroanatomy. Before we get completely microscopic, let's quickly get our bearings and establish exactly where we are in the body. You have 2 kidneys, and they're located symmetrically on either side of your spinal column, tucked back securely into the posterior abdominal wall. And sitting right on top of each one, almost like little hats, are your adrenal glands. Now, looking at the overarching blueprint of the kidney itself, the main structure is the renal lobe. It's beautifully composed of 2 distinct regions. You've got the inner medullary pyramid and the outer cortex. And to do their job, these lobes require a massive continuous amount of blood flow, which comes in hot, supplied directly by branches of the renal artery. All right, now let's zoom way in to the absolute star of the show. Meet the nephron. This is the primary excretory component of the kidney. You can kind of think of it as the individual worker on the factory floor. Each single nephron consists of a renal corpuscle and a renal tubule. Remember that renal artery we just talked about, bringing blood into the kidney? Well, the absolutely tiniest branches of that artery are called afferent arterioles, and their one specific job is to supply blood directly into these hardworking nephrons. That brings us right to section 2. Step 1, glomerular filtration, or as the subtitle says, the pressure cooker. Now, this part is just brilliant physics. Inside the renal corpuscle, there's a network of tiny capillaries called the glomerulus, all wrapped up in something called Bowman's capsule. But look closely at the size comparison between the 2 blood vessels connecting to it. The afferent arteriole, the one bringing blood in, has a larger diameter, but the efferent arteriole, the one taking blood out, has a much smaller diameter. It's basically like putting a kink in a garden hose. This very specific size difference creates a bottleneck effect, purposefully driving up incredible pressure within the glomerulus. And that high pressure? Totally not an accident. It's the physical force driving this entire first step of filtration. The pressure literally squeezes substances out of the blood and into Bowman's capsule through tiny spaces in the membrane. It acts like a microscopic colander. The smallest substances get forced right through. We're talking water, nitrogenous waste, amino acids, glucose, plus sodium and calcium ions. On the flip side, the larger elements, specifically your plasma proteins and red blood cells, are simply too big to fit through the membrane gaps, so they stay safely right where they belong, inside the blood. Let's keep moving. Section 3. Step 2. Tubular reabsorption, also perfectly known as the recycling center. At this stage, the fluid that just got forcefully squeezed out, it is absolutely not urine yet. It still has to travel down a highly specific winding pathway known as the renal tubule. And it's not a straight pipe. It's a complex road consisting of the proximal convoluted tubule, down through the loop of Henle, up into the distal convoluted tubule, and finally into the collecting duct. Here's where your body proves it's the ultimate recycler. It doesn't just throw everything away. It deliberately reclaims the good stuff. Think about it. All that water, glucose, and those amino acids that got squeezed out in step 1, your body desperately needs those. So as the fluid travels through the tubule, it reabsorbs useful substances back into the paratubular capillaries. Those are the tiny blood vessels hugging the tubule. Glucose, amino acids, and some of those sodium and calcium ions are grabbed back via a process called active transport. Meanwhile, the body naturally reclaims the water it needs through osmosis. It is just a staggering feat of biological salvaging. Which brings us to section 4, step 3, tubular secretion, the final purge. This is the final step of the actual production process, happening mostly in the distal convoluted tubules. If the last step was all about rescuing the good stuff, this step is about actively, forcefully throwing out the remaining trash. The tubules target very specific, stubborn wastes that are still lingering in those peritubular capillaries. We are talking about larger nitrogenous wastes, excess hydrogen ions, and excess potassium ions. These get secreted directly from the capillaries into the tubular fluid to ensure your blood stays perfectly balanced. All right, finishing up with section 5, the final output, completing the cycle. So the really crucial takeaway here is that creating urine isn't just a passive leak. It is this incredibly elegant, highly active 3-step dance. Step 1, glomerular filtration, using crazy high pressure to physically sort substances by size. Step 2, tubular reabsorption, smartly reclaiming the water and nutrients you literally need to survive. And step 3, tubular secretion, actively hunting down and purging any remaining targeted wastes. After surviving that entire microscopic gauntlet, the resulting fluid is finally the finished product. From here, these perfectly refined wastes will just continue their journey down through the rest of the urinary system, eventually passing out of the body entirely as urine. A highly engineered exit strategy for a highly engineered biological process. It honestly puts a totally normal, everyday bodily function into a completely new perspective, doesn't it? Millions of nephrons, high-pressure filtration bottlenecks, active transport, osmosis. All of this complex chemistry and physics is happening continuously inside of you 24/7, keeping your system perfectly balanced. So the next time you take a bathroom break, maybe ask yourself, what other microscopic miracles is your body pulling off right this very second without you even noticing? Thanks so much for joining me on this explainer, and definitely keep staying curious.